So this is a brand new service that we are just now beginning to deliver, and you are actually our very first participant. So thank you so much for agreeing to do this. So what we're going to do today is run through a very general cranial nerve examination. Okay, I'm sure you know what's involved with that. You do. Okay, so just before we begin, I'd just like to run through with you some of the aspects that will make this different to a face-to-face cranial nerve exam. So this is basically virtual. We're delivering this via webcam to you, so therefore I have no control over your environment. So I'd just like to check with you, are you comfortably seated? Yeah, you look like you are. Good. Have you got a clear picture of me? You can see me clearly? Great. And I can see you very clearly as well, so that's good. Are you likely to be disturbed in the next 30 to 40 minutes? Okay, fantastic. And if I could ask you to just dim your lights. Perfect. We'll be using a flashlight for parts of this test, and it kind of works better in a lower light. Okay? So obviously there's going to be no touching, so therefore no need for gloves. And as I can't touch you, occasionally I may ask you to touch you. For example, in one part of the test I may ask you to puff out your cheeks, and then I may ask you to press against your cheeks rather than me doing it. So this is kind of like more of a partnership, more of a cranial nerve exam that you can deliver part of it onto yourself, if that makes sense. Okay, so the other difference is that we won't be able to do the taste and smell test in the same way that we normally would, so we'll just be delivering that via some questions. We'll run through a quite a detailed eye examination, and the facial sensations and the facial movements, we'll run through that quite detailed as well. And for the hearing test, I will just ask you to make sure that the room you're in is quiet. If you have a television on, I would ask you to turn it down, or even better, turn it off. Do you have your earphones with you close by? Good, because we'll be using those a little later. And do you have a drink, a glass of water? Perfect. Okay, so if we just begin then with some basic questions, which I'm going to be typing up on my computer here, so let's just get it loaded up. Alright then, so if I can just confirm your name. Perfect, and your date of birth. Lovely. Yep, there you are. Okay, so you've been into this clinic, into our face-to-face clinic, quite a few times over recent months, I can see. You've had a few different eye tests done, you've had a hearing test done, and you had your annual health check here as well. Perfect. So really you are the ideal participant for the e-clinic, because we already have a lot of your details on record. If I could just run through a few more questions just to check that nothing has changed. Okay, So are you currently suffering from any illnesses or injuries? So nothing that would prevent you from taking part in this exam today. Brilliant, brilliant. And thinking back over the past couple of weeks, how would you describe your sleep quality? Okay, so how many hours would you say that you're getting per night? Okay, I think I recall last time when you came in, you said that you were getting approximately 7 hours. Would you say it's dropped a little? Okay. Can you think of any reason that might be? Okay. Yeah. So it's getting darker out, isn't it? Is it making it a bit more difficult to sleep? Okay, right. Okay, and I could just ask you, do you smoke? Good, good. And do you consume alcohol? Yep, okay. How often and how many units approximately per week? Okay. That's perfectly a normal, healthy amount, so don't worry. Do you engage in any recreational drug use? Okay. And have you ever in the past? Okay. Do you have any recent measurements of your height or weight? Okay, good, good. So your height is 5'6", perfect. And your weight? Okay, so that is almost exactly the same as the record that we have for you on the computer, so you've maintained a stable weight. Good, good, that's really good. Okay, let's just check your allergies. Perfect, okay. So that's the same as before, great. And your medications, are you currently taking the same medications you were when I last saw you? Yeah. And are you still finding them effective at controlling your symptoms? Good, okay. Okay, if we could just, 2 last questions, one about your diet and one about your exercise, okay? So could you just talk me through your typical daily diet? What would you generally have for breakfast? You don't have breakfast. Okay, do you just have a coffee? Right. So breakfast is great if you can have breakfast. I know that sometimes you don't have the appetite for it in the morning. Is it possible to have a snack around 10 or 11 a.m. instead? If you find it difficult to eat first thing, then perhaps just at least have a snack around mid-morning. Yeah, it just helps get your body kind of in a state to use energy more efficiently. Otherwise you're going to be feeling a bit sluggish, and then by lunchtime you might be tempted to snack on kind of sugary, high-calorie foods, which we would probably like to steer clear of. Okay, so what would you normally have for lunch? So a hot meal, okay? Is that something that you normally get in your work cafeteria? Yeah, okay. And do you have dinner when you get home from work? Okay, so what would that be generally? Okay. And in terms of snacking, would you say that you snack frequently? So when you snack, are you more likely to snack on things like chocolate, sweets, crisps, or fruit, nuts? Okay, right. So just by what you've told me there, I'm noticing that it doesn't sound like you're getting quite enough fruit and vegetables in your diet. Would that be fair to say? Do you like any kinds of fruit and vegetables? Do you think that you might be able to incorporate a few more into your diet? You can try. Okay, that would be great. It would be great if you could try. Okay, and in terms of exercise, so last time I think you said that you did, let's just pull it up on the screen, cycling. Is that still correct? Yeah. Okay, cycling is very, very good for you. Cardio activity is really good for your heart. Okay, do you do any kind of resistance exercise? Anything that is more muscle building? Okay, brilliant. Okay, so that is all for the questions. Okay, just going to close down my monitor over here, okay? Great. Alright, so if you're ready to begin the cranial nerve examination, we will start with your eyes. Okay, there's a few different cranial nerves around your eyes, so in total there's 12 cranial nerves of your face, and they fall roughly into 5 categories: eyes, hearing, facial, sensations, taste and smell. There's quite a few of them around the eyes, so one of which is the optic nerve, which controls your vision, and there's a few that control kind of your eye movement. So if I could just ask you to lean in just a bit closer to your camera there. Yep, I can see you. Good, good. And I'm just checking, can you still see me clearly? Okay, perfect. So could you just pop your glasses off for a moment? Fantastic. Yeah, that just helps me to see your eyes a bit clearer. Okay, so first of all, if you could just close your eyes. Good, good, and then open them. Perfect. Okay, this time close your eyes really tightly. Really crinkle them up. Perfect. And then open your eyes really wide. Great, great. Okay, can you wink? Can you close one eye at a time and not the other one? Okay, good. And the other one? Brilliant. Okay, so if you keep your head still for me, can you just with ceiling. Great. And then look down to the floor. Again, keeping your head still. Sometimes it's tempting to move your head. If you just perhaps put your hand underneath your chin, just to make sure that you keep your head level and in place. Great. Yep, so look up to the ceiling again. Perfect. And look down to the floor. Good. Again, keeping your head still. Just with your eyes, look over to the left. And look over to the right. Fantastic. Okay. Now, we might do that again shortly. But for now, if you could bring your face very, very close to the camera, just so that one eye is kind of very clearly in focus. And what I'd like to do, if it's okay with you, is just do a little check of your pupils. So what I'm going to be doing is putting on the flashlight. Okay, it's quite bright. Be moving it in and out, and just having a look at how well your pupils dilate. And also, just going to be checking for any different kinds of signs of symmetry, and as well as just the general eye health. So I'm looking to see if your left pupil is going to react in the exact same way as your right pupil, okay? But we'll do this one at a time. So first of all, if you could bring your left eye up to your camera, a little bit closer. A bit closer. Perfect, perfect. That's fine, you can stop right there. Okay, if this is uncomfortable, let me know. Great. Okay. Good. Just bringing the light in and out, in, out, in, and out, in, and out. Okay? Now stay where you are, okay? Just with your eyes, if you could look up, look up, look up, look up. Good. Look down, look down, look down, look down, look down, look down. Okay, good. And look over to the left. Perfect. And look over to the right. Lovely. Okay. Alright, you can move back a little bit, take a break. Brilliant. Okay. Just kind of roll your eyes in a circle. Yep, so like this. Clockwise and anti-clockwise. Fantastic. Okay, if you could just blink. Close your eyes tightly and open your eyes wide. Fantastic. Okay, if you're ready, I'd like to check into the other eye now. So just come up closer to your camera. Good, a bit closer. Just a tiny bit closer and stop. That's great. Okay, so I've just got your right eye in focus now. Perfect. So you probably won't be able to see me very clearly. Might be a bit out of focus, but can you see the light? Good. Okay, just look straight ahead. Don't focus on anything in particular. Just going to bring this light in and out and have a look at your pupil dilation, just like we did on the other side. Okay? Good. Perfect. Again. Fantastic. Good, good. And brilliant. Okay, keeping your head still again. Look up towards the light. Look up. Look up, look up. And look down, look down, look down. Look down. Great. Look over to the left. And look over to the right. Okay, fantastic. Look center. And perfect. Okay, so what you can do now is just blink. Roll your eyes in a circle. Okay, fantastic. I saw very good symmetry on both sides. They both reacted in exactly the way that I would hope them to, so that was fantastic. Okay? Just take a little break for a second, okay? Just gonna write up how we're doing so far. Done that. Perfect. Okay. Alright, so we'll pop the light down for a second, give your eyes a rest from it. Okay, if you just, I'd like your head to be kind of as far from the camera as mine is right now, okay? So I'm thinking maybe about 30 centimeters away from your camera. So what we can do now is just a very simple follow the finger test. We'll repeat this afterwards with the flashlight. Okay, so if you just bring yourself just a bit closer to the camera, I'd say roughly 30 centimeters away from your webcam. Perfect, that's good. So you're kind of about the same distance as I am. Can you still see me completely clearly and in focus? Excellent. Okay, so I'm going to be using my finger and we're just going to be writing some letters. I just want you to follow it around the screen. Okay, we can do this with one eye at a time. So if you cover one of your eyes, anyone, that's totally fine. Great. So what I'm looking for is quite smooth tracking motions, that your eyes are moving along smoothly rather than being kind of jagged and jumpy. Okay? But just do what's natural to you, okay? And I'll be observing. Okay? So look at my finger. Good. Perfect. Very good. Okay, so kind of a H shape. Okay. Fantastic, kind of shaped like a P. Okay, let's do another one. speed it up a little bit, alright? Perfect, of course that was a T. Good, okay. So if you switch, cover the other eye. Brilliant, okay, we'll just do the same test. Again, we'll do the same letters to keep our results stable and reliable. Okay, so we'll start with the H. Very good. Great, okay. And then we'll do the P. So this one's a bit different, of course, because we've got a curved movement for you to follow. Brilliant. And then the T, and we'll do that a bit quicker for you. Perfect. Okay, so if it's okay with you, I'd like to do the same test with the flashlight. Okay, you can use both of your eyes this time. Okay, yeah, just uncover your eye. As this is bright, maybe you could sit back a bit further. Perhaps kind of this distance. Yeah, great. So perhaps we'll do some numbers this time, okay? In the shape of numbers, alright? Just follow the light with your eyes, both eyes together. Good. That might come out backwards. Okay, let's try it the other way around. Very good. Perfect. Okay, let's do another one. Good, again. Fantastic. Okay, one more. Yep. It's kind of meant to be a 6. Perfect. Okay. The next test, I'd like to ask you to cover your eye on this side. So for me, this is my left. For you, it will be your right. Okay? If you cover it, I'm covering mine as well. And then with your other eye, if you look directly into my eye, okay? Just keep looking directly into my eye. Got my finger just off to the side here. And can you see I'm wiggling it? Good. So what we're going to do, you keep looking in my eye and just let me know when you can see that my finger is wiggling, okay? Fantastic. Okay. So keep looking into my eye. Perfect. Yep. Good. Just gonna move it down. Let me know when you can see it move. Yes, very good. Let's do it up high. Tell me when you can see the finger move. Fantastic. And last one. Perfect. Okay, we'll swap sides. So I'm going to cover my right eye. You cover your left eye. Good. So, look directly into my eye. Yep. And just off to the side, can you see my finger? Keep your focus on my eye, so you're just looking with your peripheral vision, okay? At my finger. Okay, and just let me know when you can see it moving. Good. Perfect. Just bring it down to the bottom, okay? Yes, very good. Yep, good. Up to the top, remember, keep looking deep in my eyes. Perfect. One more up there. Good. And keep looking in my eye. Good, good. Fantastic. One more. Great. Okay, that's all. Okay, perfect. So, we've tested a lot of the different nerves that are kind of in control of your eye movements. So now we'll just quickly have a look at the optic nerve by doing the regular eye chart test, the Snellen test. I'm sure you've used one of these before. Fantastic. Okay, if you normally wear glasses, you can pop them back on now. Yep, perfect. So here's the eye chart. Okay, I'd say sit back a tiny bit from your camera and I'll step back, okay? Alright, I'd say that's a good distance. Do you feel like that's a good distance? Perfect. Okay. So yeah, with your glasses on if you need them. What line can you see to clearly? Good. Can you see below the green line? Should we do the one above the green line then? Okay. Alright, so if we just run through, tell me what letters you can see. Yes, E, good. Yeah, D, yeah. That's an F, perfect. C, good. And Z, yes. And finally, the P, perfect. Would you like to attempt the next line? Yeah, we can attempt it. Don't worry if you don't get it 100% right, that's fine. F, perfect. And E, good. Yes, L, fantastic. O, good. We've got P, that's right. We've got Z, good. And we've got D, yes. Can you see any lower than that? No, not from this distance. Okay, what we can do then is I will just bring it in a bit closer. Alright, you can lean a little bit closer to your camera as well. Alright, and maybe if we just attempt the line above the red line, okay? Great. D, good. Yes, E. It's F. P, perfect. O, good. We've got T. pronunciation part of the test, okay? How did you find that? Did you find it was easier or about the same as doing a face-to-face test? Okay, yeah. It is nice to be able to do these things from the comfort of your own home, isn't it? Great. Okay, so we'll just briefly do a little bit of a hearing test for the auditory nerves, the ones deep in your ears, okay? So, don't worry about your earphones just yet. What I'm going to do is I'm going to stay exactly where I am. Don't adjust the volume on your computer or your phone. Just stay as you are. And I'm going to say some numbers. And I'm going to gradually get a bit quieter and quieter and quieter. And I'll gradually sort of fade into whispering. And just see how quiet I can get. And it might get a little bit inaudible. Just repeat back the number to me. When you can't understand what I'm saying anymore, that's fine. Just tell me, okay? Alright, so we'll start at this volume. Okay, ready? 17. 17. Great. Okay. 42. 42. Good. 39. 39. Great. Okay. 27. 27. Good. Okay. 18. 18. Yeah, good. Okay. 6. 6. 6. Good. Okay. 94. Getting a bit trickier. Okay. 94. Yes. Okay, last one then. 88. That was 88. Okay, fantastic. So, if I could ask you now to pop in your earphones or your headphones. Great. So I'm just going to send through my microphone, okay, some sounds that are going to reach you in either your left ear or your right ear. You can either say to me left or right, or you can raise your hands for left and right. Totally up to you, okay? Fantastic, okay? So we'll do a scratch on either side of the microphone, okay? Good, good, in your left. Perfect. And again. Good, okay. Both. Perfect. Okay, if we do it as a little bit of a pattern, okay? Could be left, left, right, right, left, right, or maybe right, both, left, something like that, okay? So what did you get that time? Left, both, right. Good. words out now if you like. We don't need them again. That was really, really good actually. That was, because we've not done this test before, kind of virtually, so that went surprisingly well. So thank you for being the first one to try that with us. Okay, so what we'll just do now quickly is taste and smell. Now, taste and smell, we would normally use little samples to ask you to actually physically taste and smell them and to identify what it is, what the scent is and what the taste is. Obviously, as we're virtual, we cannot do that, so I'm just going to ask you a few questions about your taste and smell. Okay, so have you noticed any changes in your sense of smell recently? Okay, I see. Okay, so you've had a bit of a blocked nose recently. Okay, has that cleared up now? Yeah, it's quite normal when you've got a blocked nose to not be able to smell things as well. Okay, so if I just say to you some kind of overall smells, and if you could just kind of try to describe them to me. Okay, so, or perhaps tell me if you can imagine that smell. It might be difficult to put it into words, okay? Alright, so the smell of a bakery. Is that something that you can kind of pinpoint in your mind? It's quite a distinctive smell. Great, okay. Coffee, or the very strong smell of a coffee shop. Yep, just imagine that for a moment. Okay, is that a smell that you can kind of recognize? Fantastic. Okay. Cinnamon. Good. And one more kind of distinctive smell. Let's go with mint. Is that something you can imagine clearly? Fantastic. Okay. So in terms of taste, I'm going to ask you to get a little bit more descriptive for me. Okay. Can you describe to me the last meal that you had? Don't tell me what it is, okay? Just describe it to me in terms of the tastes. And I'll try to guess what it is based on what you're telling me. Okay, good. Perfect. Okay, that sounds to me like spaghetti, bolognese or lasagna, something like that. Am I right? Perfect. Okay. Right. So let's do something again, just like that. Instead of your most recent meal, try to describe to me your favorite meal or your favorite food, just in terms of the taste. Okay. So is that, I would just try to guess something sweet. Okay. Is it chocolate? Great. Okay. Perfect. Okay, so if I just run through with you the different tastes, we have sweet, salted, bitter, sour, and sharp. Okay. If you just tell me off the top of your head say something sweet, something that has a very distinctive sweet taste. Honey? Good, okay. Something salty. Try to kind of imagine it. Pretzel, okay, perfect. Bitter. Coffee, yeah, or tea, perfect. Okay, sour. Yeah, like lemon, okay. And sharp. Good, like a grapefruit. Okay, I feel like lemons and grapefruits are they're both a bit sharp, aren't they? Okay, perfect. So we've done the eye test, we've done the hearing test, we've run through some taste and smell questions, and I'm kind of gathering that your taste and smell is normal. Yeah, good. So if we now move on to the next bit. So the next bit kind of concerns your facial sensations and your facial movements, and a lot of the cranial nerves are kind of related to these parts, okay? So if you keep your head completely still and just come a bit closer. Yes, I'm kind of hoping to see your entire face. A little bit closer though, and stop. Yeah, so I've got your entire face in focus and not too much background. Perfect. Okay, so I'm going to ask you to do some facial expressions and some facial movements, and obviously as I cannot touch your face, I might at times ask you to touch your face. Just checking, are you okay to touch your face? Perfect. Okay, so we start with kind of a simple one. If you just raise your eyebrows. Yes, good. Okay, so if you get your fingers with your eyebrows raised, press along. Do they feel kind of even to you? Do you feel like you're raising them both to an equal height? It definitely looks even to me. Good, okay. And then if you frown your eyebrows, not like I did, do a much more exaggerated frown, like a cartoon character is frowning, okay? And then with your fingers, just feel along the top of your brow. And then move your hands away, good, and just frown again. Okay, yeah. It's a little bit difficult not being able to touch. Okay, but that looks good to me, okay? Right, next, if you could just kind of purse your lips together, kind of like a pout or a kiss. Do it nice and exaggerated. Okay, could you turn your head to the side? Okay, yep, do it again for me. Fantastic. Okay, good. Could you turn your head to the other side? And purse your lips again. Nice big pout. Perfect. Okay, back to the middle. If you could open your mouth wide. Wide. Good. And say ah. Good. Okay, all looking great so far. Of course, we're doing this virtually rather than face to face, so it's not going to give me as accurate a picture as if you were in the same room as me, but the lighting is good and I can see your face very clearly, and it all looks quite symmetrical to me. Okay, great. If you could fill up your cheeks with air, sort of blow them out. Like that. Good. Just fill them out as wide as you can. And then with your hands, just gently press against. With your hands, try to pop the bubble. Good, yeah, and try to resist against that. Lovely, okay. Press a little bit firmer. Try to pop the bubble again. Great, okay. That was really good. So, if you could next crinkle your nose. Good. Good. Okay. Turn that one, blow out cheeks. Okay, give me a big smile. Yeah, big white smile. Fantastic. Yep, looks approximately even to me. Good. Okay, and now kind of like a sad face. So the corners of your mouth come down a bit. Very good. Okay. If you wiggle your jaw, okay, so you can kind of move it from left to right. Great. Yes. Done that? Perfect. Okay. Could you poke out your tongue? Lay your tongue flat and poke it down all the way. Good. And then try and poke your tongue upwards towards your nose. Don't worry if it doesn't reach your nose. Just kind of towards your nose a bit. Good. And then poke your tongue all the way to the left. And all the way to the right. Perfect. Okay, hold that and put your tongue back in. Good. Okay, good. Can you lift your head up to the ceiling? Good. And then try to rest your chin on your chest. So, all the way down. Fantastic. Okay. Can you turn your head all the way to the left? And when you're turning, use your other hand to press against. Try to apply a little bit of pressure, just press against. But let your head kind of win. Good, and then go the other way. Turn your head to the other side. Using your hand to resist. Fantastic. Okay. Alright, with your shoulders, just give them a bit of a shrug. Good. Shoulders back. Shoulders up. Really exaggerated, almost like your shoulders are trying to reach your ears. Can you do one at a time? Just lean back a bit for me so that I can see your shoulders a bit clearer. Yep, so one at a time. You can try to keep your head still, not like I did, just so that one shoulder is up, and then drop it down, and then the other one, and then drop it down. Okay, if you do that again, I'm just gonna try and see whereabouts they land. Okay, good. The other one. Good. Okay, very good. Right. Now your neck, okay? Tilt your head one side. You should feel a stretch side? Is that painful or uncomfortable in any way? Okay, good. And then the other side. Tilt and feel a stretch. Okay, good. Is that painful or uncomfortable in any way? Okay. Keep your shoulders and your torso still. Using your neck, turn your head as far as you can, so almost like you're looking over your shoulder. Good. And then the other direction. Okay, good. How did that feel? Fantastic. Okay, last couple of bits now. Okay, I know this has gone on a bit longer than I said it would. Kind of aimed for 30 to 40 minutes. I think we've gone probably much over that, but okay. Do you remember I asked you to get a glass of water? Okay, so if you could take a sip of water for me. Good, and I'm just going to kind of have a look at your swallow. If we could do this face forward, and then if you could turn sideways so that I can see the swallow from 2 different angles. Alright, so take your first sip. Great, great. And then turn to the side. Take your second sip. Perfect. Okay, turn to the other side. And take a swallow. Sip, yep. Good. Perfect. Okay. Do you happen to have any food nearby? It's okay if you don't. So I'm going to ask you to do is kind of simulate a chewing motion. You can just kind of chew air, or if you've got some food, probably something a bit chewy or crunchy, something that's going to mean that your jaw has to do quite a lot of work. Yes, apple is fine. Okay, yep. Just have a little look, just for a few seconds, if you just chew. Good, so I'm looking at the motion of the jaw. If you turn to the left. Okay, yeah, keep chewing, good. And then turn your head to the right. Keep chewing. Perfect. And stop. Yeah, swallow what you've got in your mouth, of course. And the last part, okay, I ask you to do a cough. Perfect. Okay, yes, this was brilliant. So, just write down a few notes about how this went. Of course, this is our first time delivering a cranial nerve exam via the e-clinic, so at the moment we're still kind of testing this out, and if it's successful then we're going to roll out e-clinic sessions more frequently. Obviously, some things cannot be tested via webcam, some things you need to come in for example your blood pressure, etc. But we thought cranial nerve exam would be a good way of testing how well this e-clinic works. So, can I just quickly survey you? So, on a scale of 1 to 10, how comfortable did this examination feel for you? Okay, good. And would you recommend to a friend? On a scale of 1 to 10, 10 being definitely would recommend, 1 being definitely of convenience. Do you find it more convenient to come in to the clinic for a face-to-face appointment, or do you find it more convenient to stay at home and do it via webcam? Perfect. Okay. Right, so what I'd like to ask you to do is, in about a week or perhaps 2 weeks, I will invite you in to the clinic and we can run through a face-to-face cranial nerve exam. And what we're going to do is compare the results of this test to the face-to-face one. And if we get similar results, then that's going to be a kind of a point in favour of e-clinics being a viable option. Yes. So we'll see how reliable the results are, basically. Perfect. Well, thank you so much for doing this. It's definitely been an experience for sure. Okay. So, yes, I will send you a letter through the post for your next appointment, and I really hope that you enjoy the rest of your day or the rest of your night.